Hey friends, Dr. Nixon here. Welcome back to the Winston Wellness Summit. I have an amazing guest with us today. Her name is Dr. Nicole Craven. She is a medical doctor over at Robin Hood Integrative Health, and super grateful to spend some time with her. And we're going to talk about kiddos. We're going to talk about immune systems and kiddos and ear infections. So if you have friends, family members who have young kiddos and are looking for a more holistic or natural approach, share this information with them. So Dr. Nicole, super grateful to spend some time with you. Thank you so much for coming on. Appreciate it.
Absolutely. Love being here. Thank you.
Yeah. With Robin Hood Integrative, I've gotten to know Dr. Wiggy and Dr. Lanthelm over the years. Our old office was y'all's store back in the day.
Wow.
They were upstairs, we were downstairs. So, honestly, I'm really grateful to have Robin Hood in our community here in Winston-Salem. You guys, I know you probably hear this from your patients, and I really sincerely mean this. You guys are changing lives. Like, you guys are really providing hope and health and answers and clarity and direction for so many people. And I know sometimes as practitioners, we can get our heads down sometimes and forget just how much of an impact we make. So I just wanted to take a moment to say you're doing a good job. How long have you been over at Robin Hood?
Thank you for that, by the way.
Yeah.
We do put our heads in little clouds sometimes. So I love my job, and I really enjoy hearing that. It gives me motivation to keep going. I have been there only for a year. Did you ask how long I've been there?
Yeah.
Yes. So I am a pediatrician primarily, and I've only been there for a year. We have another pediatric nurse practitioner, and then we just hired a third pediatric nurse practitioner. So we have 3 for our pediatric team now, which is really exciting. I moved from Florida. I'm from the area, and I moved from Florida, and then I really wanted to be back in North Carolina, so I joined this practice.
Yeah, that's so cool. My wife and I grew up in Ormond Beach.
Oh, wow, yes.
And then I did undergrad at UCF in Orlando. So Florida's our old summer guys. Do you love fall? Do you love being back here for fall?
I love North Carolina. I think I didn't realize how much I love it. And
yeah.
Then I longed for it, and my journey brought me back here, and I'm very happy to see the leaves, and I love the mountains. Just went to the beach. It's just wonderful.
It's the best. I love North Carolina. I love Winston-Salem. We really do love our city. So I remember the day I got the email from Robin Hood that, hey, we're bringing on a pediatrician. I said yes, super excited. Our patients were like, yes. But here's for all of our listeners out there, when we hear the word integrative or integrative medical practice, give us the answer. Give us the difference between integrative versus, I guess, traditional, if that's the right question, or maybe more holistic versus allopathic. Give us what the difference is.
Right. So this is what I love. I love what I do in terms of that. We do two things that are super important. One is that we address dis-ease in the body by getting to the root cause of where it's coming from, which is usually an inflammatory process. And then we try to allow the body through various supportive systems to heal itself to get rid of that dis-ease. Unfortunately, 1 in 2 children have a chronic illness now. So it's a very important thing to then stop that process so you don't progress to more and more chronic illness. And then the other thing that we do that is really, I feel like, is even more needed in our current time is prevention medicine. We look at all the various aspects of the body. We put it all together, and we look at little things, little symptoms, vague things of how we can optimize wellness from all different perspectives.
Yeah, which is so important and so valuable. I think a lot of times I'll answer that question. We talk more holistic versus allopathic, and again, to be super clear, I have nothing against drugs or medications and traditional medical modeling. Some of my best friends are medical doctors, but I think the system sometimes is the allopathic model is name the symptom and then treat the symptom.
Correct.
Versus what I'm hearing you say is, okay, that's fine. We can treat a symptom if we need to, but the better question is what's at the root, right? Or what's causing this? Let's start talking more about causation instead of just treating a symptom. Is that what I'm hearing?
Yes, very much so.
Yeah. Okay. So with kiddos specifically, I mean, give us the. I mean, I'm sure you guys see a lot of different things that come into the practice, but give us the list of maybe the most common ones you guys see come in.
Common, I would say asthma, allergy, eczema, like the allergic triad is very common right now, and that includes food allergy, which is more prevalent these days.
Right.
I do a lot of autism, specifically the entire spectrum, not just the severe autistic spectrum child, but like any sort of sensory integration disorders
Wow.
or even social awkwardness. And then all the way into mental health with anxiety and depression and OCD. We see a lot of post-inflammatory infectious diseases. So sometimes we'll see things like pandas, which is an inflammatory illness of the brain that is caused by strep. And we see a lot of immune dysfunction in general, like a vague immune dysfunction, and try to boost the immune system a lot. And gut, I can't believe I didn't say gut first, right? So any sort of gut disruption, whether it's constipation, diarrhea, mix of both, IBS, irritable bowels, IBS, inflammatory bowel disease, reflux, severe reflux, esophagitis, bloating, gas, on and on and on in terms of the gut, of course.
Yeah, I mean, I feel like the gut is so important to so many of those things that you
Oh,
had mentioned, the
yes.
immune system, the gut-brain connection, and then you had said the word inflammation. So give us, I mean, you said that was one of the big culprits, and I agree with you with a lot of dis-ease in the body. Inflammation, I mean, can be generated by so many things. I mean, for some of our parents they're trying to do good things by trying to get their kids to eat better food, better nutrition, decreasing stress, trying to get some good supplementation in there. Is there a go-to or will give us like one or two just easy steps for most parents that they might be able to do with their kiddos to decrease inflammation?
To decrease inflammation, well, it always goes to the gut.
Okay.
So anything that you can do to make the gut healthy is going to help, and you just hit on a lot of those. It's we say a clean diet. It's very hard to understand sometimes what an actual healthy diet is. It's kind of easier to picture what would be a clean diet because there are foods that you can eat and you feel congested just right after you eat them, like really heavy carbs or lots of sugars or lots of dairy or lots of glutinous bread or something. And then also, in addition to those foods, to clean up the diet is to actually put the natural plants and animal proteins from a very healthy, happy source into your body. And that's more of a cleansing process. So, of course, the basics that you hear all the time is, try not to eat as many packaged food, try to cook as many natural foods as possible. And now the biggest one for me that I'm on a bandwagon about is trying to avoid Roundup and genetically modified foods. Because
Wow. Yeah,
boy,
yeah.
do we have a lot of toxins in our body now.
I mean, it's so true. I mean, the pesticides, right? The glyphosate. I mean, those things are designed to kill organisms, to kill bugs, and then we're consuming them. They're going into our gut, right? Like destroying our probiotics, destroying our digestive system, weakening
No
our immune
doubt.
system. Yeah, I feel like that's a big one in that I've been more recently just attuned to as well.
Yes,
Yeah.
yes, I've paid so much attention to it. I dream about it, I think. But also, then in addition to that is supporting the gut. So trying to clean out the gut, you can't be perfect because the American diet. Oh my gosh, I mean, in order to get a really truly clean diet, we have to not do 99% of what we hear or thought we were supposed to do. So you can't be perfect with diet. So how can you support the gut in addition to that? I do a lot of prebiotic fibers. It's kind of like an exfoliant for the gut that lays down the the environment for healthy bacteria to be there and stay there and help us digest our food. And in terms of healthy bacteria, you can actually take probiotics. I'm sure that, a lot of people have heard of probiotics right now, which is just the healthy version of bacteria that helps populate the gut. And you can do that once you're well. You can take probiotics and to help you have a plethora and a very diverse group of bacteria and other microorganisms in the gut, like you mentioned, the microbiome, which is not in our soil as much, and so it's also being killed in us a little bit too much. So that is an instant booster for the immune system, no doubt.
You had mentioned, I think a lot of people have heard of probiotics, but you had mentioned prebiotics, which I think is probably going to be fairly new to a lot of people. What might be some examples of prebiotics?
So you can, there are supplements where it's just fiber, of course. It's a fibrous type supplement, but you can eat as many prebiotics as you'd like. And that includes things like inulin. Inulin is a type of prebiotic. Green bananas, so not the brown bananas that you use to make banana bread, but green bananas. Jerusalem artichoke.
Okay.
There's quite a list actually that you can eat, like ingest prebiotics. They're not necessarily the top 5 favorite kids' foods, but you can sneak them in there.
Yeah, no, that's so true. It's all, I mean, we, as parents, we get creative, right, about getting greens into our kids' life. My son's 4. He ate arugula the other day and loved it, but then next week he won't. So,
right. Oh yeah. Yeah, and he could love it for like a whole month and then all of a sudden not touch it, right?
Right.
Yeah.
Right. I want to jump into one of the things that I know you guys see a lot of and help a lot of kiddos with: ear infections. So, I mean, we've seen the stories of kids who come in who've had tube surgeries, multiple tube surgeries, scarring. They're on rounds and rounds and rounds of antibiotics. And again, when you're a parent and you have a kid who has an ear infection and they look pitiful, they have a fever, all the things, you want to try to do the right thing, but a lot of times you're met with antibiotics, which is fine. But when that starts to happen over and over and over and over again, I feel like we're missing something, right? So give us some of your knowledge and expertise on just, kind of, again, asking the better questions. What's at the root cause? What do you see most with ear infections and getting kids better?
And are you asking in terms of prevention first, or are you asking in terms of how, if you already have congestion behind the ears or even pain in an ear infection, how to get rid of that?
Yeah, no, that's a beautiful question. Let's go with the mom that comes into you or the parent that comes into you and they're full on.
Okay, we'll do that first. Okay. Well, it is actually quite beautiful that even in conventional pediatrics now, it is suggested that if you have even a bulging ear infection with, yellow pus behind the ear, like really bad one that hurts, that as long as you can help soothe the pain, and I like to add into that, help the mechanical and anatomical drainage of the eustachian tube, so the inner ear tube, and you can wait 3 days without even giving antibiotics. And that's because the majority of them are viral. So a lot of times you don't need antibiotics, which is wonderful, because I do a lot of what I do in terms of when I see sick children is try to figure out a way to help the body heal itself without using antibiotics. And sometimes we just have to. I mean, they're great. I want them around, but it's better if we don't have to use them.
I agree.
So now I think even in conventional pediatrics, you can do a watch and wait approach. And that's important to know so that you don't, you're not scared at home when you have a child who is in pain and in out of pain. And you're not going to do any harm by doing like a 3-day watch and wait approach. And it's okay to have the fever, because the fever is the immune system fighting.
It's that right there is such an amazing concept.
I know.
that really, I feel like, man, that light bulb for parents. And I think this is what you're saying. A fever is on purpose, right? So give us some of the information behind what a fever actually does and why we might want to not just rush to treat it?
Well, a simple way is that it's basically what you see. It's revving up the body, heating up the body, increasing blood flow to get all of our immune cells to go and attack whatever source of foreign is there. And so while you're doing that, you're killing off, some of the bad players that are there with the heat as well. So, I do know, I don't remember the last time I had a fever actually, but I do remember that it wasn't very pleasant. And I understand that side of it. So you do want to help the body stay cool to a certain extent. And, if you want to give your child Tylenol because they're miserable, then you need to do that if you've gotten to that point, of course. But allowing the body, and we've seen like with COVID, right? We've seen some of these low grade fevers. I mean, that's just the body working.
Yeah, no, it's amazing. I mean, one of the things we always tell our parents, like, yeah, so fever's on purpose. It's doing its job. Like it's the way God created the immune system. It's good. It's helping your kid keep them, snuggles, lots of love, lots of snuggles, and then keep them hydrated, right? We do a lot of
Right.
bone
Oh,
broth,
yes.
in our
Good point.
practice. Well, keep them hydrated. We don't have febrile seizures, so it's water. If you can dilute some coconut water, so you're not doing too much sugar. We'll do bone broth. My
Yes.
son loves bone broth. So yeah, I mean gosh, I love that whole thing. Okay, so you're sitting down with the parents. It's like, hey, fever's on purpose. You're talking about some of the immune system things, and so that's like in the moment we're trying to get over this ear infection.
Mm-hmm.
So then, what do you do to prevent another one from coming back?
So just to back up a little, you want to, and this is for prevention too, if there's any baseline, and this is where you come in majors, like if there's any baseline congestion, so if the ears are already stopped up, we call stopped up. Basically, if there's fluid inside in the inner ear eustachian tube already, and that can happen because of allergies, or that can happen because of reflux, your food coming up and down, and your body makes a mucus protective layer, and maybe sometimes it'll shut off those tubes. That can happen just because of your baseline anatomy, right? You want to try to get the inner ear tubes to drain before you get an infection and during the time that you get an infection. So we do a lot of different things. I mean, obviously chiropractic care really helps. Craniosacral therapy is a really good one. Getting to the root cause of the allergy or whatever's causing the mucus and the congestion in the first place, whether it's from reflux and other gut issues, or from food allergies or toxic exposures. Kids who are exposed to smoke or mold, or living by a highway is known to really increase your congestion and your chance of ear infections. So get it to drain. So how do you get it to drain when you're at home? There are some tricks. Like I like the peppermint tea steam tent. I don't know if you ever do that. It's with older kids, but you get peppermint tea in bags, and you can get cheap peppermint tea because you're not going to drink it. And you boil the peppermint tea and then put it in a bowl and put the kid's head over the bowl and put a towel over all of it and just let it drain.
Yes,
It's
yes,
awesomely gross.
that's great.
It's awesomely gross, and it works like really well. And then we do some natural nasal sprays to keep the nasal passage open, like a xylitol nasal spray really helps. Colloidal silver nasal spray, as long as it's a good source and you can trust it, helps. What other things I do to drain during the process of the heat, like with the heat and the pain when you have the raging ear infection, you actually want to put heat on the outer ear because it takes away from the heat on the inner ear.
Interesting. Wow. Okay.
Like just in that moment, that really helps.
That's so helpful. That's so helpful. Yeah, I mean, on our end, like we'll do the adjustments. We'll use high frequency vibration. I have a question for you. I've had some parents ask about like rebounders to help drainage. I mean, we've done like little trampolines, right? Like,
oh yeah.
The rebounders. I mean, we've done it for like lymphatic drainage. What about for ear infections?
I've never used it directly for ear infections, but I have to say anything that is vibrational usually really helps. And And like you said, in terms of lymphatics, right? But also for detox, which is lymphatics,
Right.
partly lymphatics. But any sort of sweating or activity or movement that's got an energetic blockage involved, I mean, this is a true blockage, then rebounding is going to help.
Yeah. So
but
good.
I've never actually. I might have to put that on my list.
We've never done. I had a mom who did it. And I'm like, it makes some logical sense. Usually, our go-to is we'll open up the ear canals, we'll adjust the upper cervicals, get drainage going. If there's infections, colloidal silver, the things that you had mentioned, 100%. So
garlic oil. That's a
yeah,
really big one.
I've never tried the peppermint tea though.
Huh?
Yeah, the peppermint tea. I'm gonna try that just for fun at home tonight.
Right. It's so grossly amazing.
Sounds grossly amazing. I love that. Okay, so then the next piece is prevention, right?
Right.
So we don't want another ear infection to come. So is this where you start going after helping the immune system, food allergies? What do we do next?
For sure. We do a lot of testing for allergies, seasonal allergies, food allergies, even food intolerances. So you want to take, right now, kids stay well just by taking away the offenders in their environment, right? And then giving back a little bit of the vitamins and minerals because our soil no longer has the vitamins and minerals that it used to. So we have a little Covert Prevention, and it's very similar for any sort of infection, which would be vitamin D, zinc, and sunshine works, but unfortunately this time of the year, the sun's rays are too sideways and we don't get out long enough. And look at this muggy day, right? So most kids, I recommend taking vitamin D with some food that has some fat in it, because it's a fat soluble vitamin. And that helps tremendously. I mean, that boosts the immune system tremendously. I just want everybody to be little birds and open their mouth and like sprinkle it all over the country. But I don't think I have the ability to do that.
Amen.
That's how much it works.
Amen. I think that's one of the simplest, easiest things we can do for our immune system. And again, I agree with you. The sun is the best, but we're not in Florida anymore.
And vitamin C rich foods really help. They're cleansing for the gut, but also for the entire body. Herbs, these beautiful herbs really help. I would say there are a lot of herbs that I use to help kids with stress and sleep, because the immune system is rebooting, revamping, working its hardest when the kids are resting. Right. So we want to get them in that rest state. So there's some absolutely beautiful herbs that can contribute to that rest state, like as simple as lemon balm or holy basil. And I'm sure these are things that you use, I would think. Yeah.
This is fun. I actually love this. This is the most amount of time, just for all of our listeners, this is the most amount of time you and I have spent together talking, and you're a breath of fresh air, honestly. Like, to have someone with your expertise, your knowledge, being a medical provider, medical doctor, but also having the in-tuneness of like, hey, there's some holistic, natural things that we can do. Sometimes they're not easier, right? Like, I think that's one of the issues we see sometimes in our culture. Sometimes it feels easier to take an antibiotic, right?
Yes.
And it's harder
in the moment, right?
There it is.
What happens is, it's uncanny how many intake forms, new patient forms that I go through, where their past medical history is recurrent ear infections. And it could be anywhere between 3 to 8 ear infections in a row with all of those antibiotics. Just, I remember, actually, that's one of the main reasons I went into integrative medicine, was because I had just gotten out of residency and I was so excited to treat kids. And I was giving them an antibiotic for an ear infection, and they'd come back miserable and worse. So you'd give a stronger antibiotic, and then they'd come back miserable and even worse. And you'd give another. And I was like, by the time I got to like doing it was my first year, and I thought it was just going to be fabulous. And instead, I'm looking in the eyes of these children and the mothers who are just really upset at this point, because we're trying, you can, at that point, are we going to go for a surgery, which is crazy?
Yeah.
And that's what the protocol was back then. So now there's just so many beautiful things that we can do in terms of prevention. And I forgot what I was even talking about with the original question.
No, it's so cool. I was just commending you. I mean, taking the road less traveled for you as a physician to say, I'm going to do some things different. And I may have to take longer with a patient. I may have to work a little bit harder. The parent may have to make some different changes, but at the end of the day,
yes, it's about the effort, and it is always a little bit more effort up front because we don't have that instant, gratification that we're kind of getting used to and our society's getting a little addicted to. But if you look at what could happen down the road of having another ear infection and more antibiotics and more time at the doctor and a kid who's in and out of pain for now, like 3 or 6 months and then into surgery, really it's a very easy approach what we do.
Yeah, it's amazing. I'm super grateful for you. So grateful. I took way more of your time than I said I was going to, but I appreciate you. And I want to commend you again. Thank you for putting in the work and the effort. I want all of my kiddos in our practice to go to you. I want to bring my kid to you. He doesn't need anything. He's really healthy, but I want him to go to you because you're amazing. How do people get in contact with you? How can they find you online? How can they learn more about you?
We're at Robinhood Integrative Health. We redid our website. So there are videos if you want to look at every practitioner, and I'm right there in one of the videos that explains more in depth what I do, I would say.
I watched it. It's a good video.
Did you? Oh,
yeah,
gosh.
All right, here's your rapid fire questions. You ready?
Yes.
I'm going to let you go. What's your favorite color?
Purple.
What's your favorite food?
Oh my gosh, I love food. Favorite food, my mom's homemade Italian sauce.
Ooh, good answer. All right, if you could be any superhero, who would you be and why?
Probably Superwoman.
Yeah, nailed it. You already are. All right, last one. If you could not be a medical doctor, if you could not work in the health field, what would you do?
What would I be?
If you couldn't be a medical doctor, couldn't be in the health field, what would you be doing?
I want 2 jobs. Oh, health field. Okay, I can't have 2 then. I was going to say veterinarian, half-time, and then National Geographic photographer of animals.
So cool. Good answers. Good answers. Dr. Craven, I appreciate you. Super grateful for you. All of our patients, listeners, check her out. Robinhood Integrative Health. You're amazing. We are super thankful for you leading the way and getting our kids healthier and better versions of themselves. They're the future, right?
Right, and we are equally grateful for you. Thank you.
Appreciate it. See ya.
Bye.